The American Heart Association works locally, nationally, and globally, quite honestly, to address the problems that are associated with heart disease, something which can affect every single one of us, either directly or through a family member. And their diligence is unparalleled. And I can say that firsthand because I've had the opportunity to work with our local chapter of the American Heart Association. And we've done some really remarkable things over the years. We've been able to look into those neighborhoods where there are high cardiac arrest rates, and we've been able to recognize that some of those neighborhoods are also those that have the lowest amounts of bystander CPR, and we have taken action. With help of the American Heart Association, we've been able to get into those neighborhoods, get in touch with community leaders and community groups, and train people on how to do CPR, and to train some of those folks to become CPR instructors to further send the message so that if someone should have a cardiac arrest, they have an increased chance of getting bystander CPR. And let's keep in mind that when somebody does bystander CPR, that patient's chances of survival more than double. So it's incredibly important. And we've been doing that for years. Let me also point out, we've had great working relationship with the American Heart Association, not only with heart disease, but also with stroke care and helping people have healthier lifestyles to reduce their risk of having a heart attack and stroke. And these are all vitally important. And these are things that we actually can do. And the Heart Association, I think, is a shining example of how this community, Houston, can come together and not just talk about doing things, but actually get them done. Every person deserves the opportunity for a full, healthy life. As champions for health equity, by 2024, the American Heart Association will advance cardiovascular health for all, including identifying and removing barriers to healthcare access and quality of care. Incredibly important. And here in Houston, we are doing that. We have more to do in the future, and I know we're going to get it done.